everybody, and welcome to Ask Dr. Bob. This is where you get to ask me, Dr. Bob Gabbay, the Chief Scientific and Medical Officer here at the American Diabetes Association, your questions related to diabetes. And so, if you're new to this, welcome. If you're a long-time person joining us, hey, great to have you back. And as you probably know, each month we pick a theme. And being that this is National Minority Health Month, we thought we would drill down a little deeper into the challenges for people of minority groups when it comes to diabetes. So let me pull up a series of questions here and let's start with, are there disparities in diabetes diagnosis among minority populations? And sadly, it is very true that there is. And I will tell you that on this session, we'll throw a bunch of statistics out because I think it helps us to understand the magnitude of the problem. So when it comes to sort of like being diagnosed with diabetes, Blacks and Hispanics are 50% more likely to develop diabetes, and American Indians and Alaskan Natives twice as likely to develop diabetes. So really, the chances of developing diabetes are much higher. And then the other group are Asians. So Asian Americans are more likely to develop diabetes. And the interesting thing about them is that uh, uh, these individuals uh, develop diabetes and tend to be thinner. So often we don't think about them developing diabetes, or at least type 2 diabetes, because of not being as obese. And so the recommendations are actually to screen Asian Americans at a lower, what we call body mass index, a measure of obesity. So, what can you do about this if you're, a member of one of these minority groups, and you wonder if you have diabetes, or you have loved ones or friends that may or may not know that they have diabetes? Take the ADA risk test. It's free. It takes about a minute. You'll find it at the American Diabetes Association website at diabetes.org. And on that website, it just asks you a series of questions, and it'll tell you at the end whether you're at high risk or not. And that's a great way to know whether someone may have diabetes or not. So, next question are, what are the common risk factors for diabetes in minority populations? Well, many of the risk factors are the same as non-minority populations. It's the having obesity, high blood pressure, um, a woman that had diabetes during pregnancy is much higher risk of developing diabetes long term. Uh, and then income. Income is a big predictor of the risk of developing diabetes, and I'll talk more about that in a moment. But maybe it's important to get to this question, and this is there a particular type of diabetes that's more common in the minority populations that we just spoke about? And yes, it is type 2 diabetes. Type 2 diabetes is much higher, 50% or more increased risk in minority populations. Type 1 diabetes actually is somewhat less likely in many minority populations. So it's really much more type 2 diabetes. Uh, the next question, moving along here on Ask Bob, is what are some of the common misconceptions within different minority populations? Well, one of the things that we hear quite a lot is that developing diabetes is sort of inevitable. Uh, you know, uh, Lots of people in my family have diabetes. I'm just going to get diabetes. There's nothing I can do about it. And it turns out there's a lot you can do about it. We'll talk about that in a moment. So you can prevent or lower your risk of developing diabetes. So it's not inevitable. And sometimes this is really disturbing. Talking to colleagues in some parts of the deep South, Mississippi, where amputation rates are really high, And there's this fatalistic view that, you know, my dad had an amputation. It's just a matter of time before it happens to me, and that's not true. There's many things you can do to prevent it. So that's one big misconception that we hear sometimes. The other is that diabetes is all about sugar. Uh, you know, I ate too much sugar, that's why I got diabetes, or I don't eat sugar, how could I get diabetes? Well, sugar can be one of the factors, but it's not all about sugar. It's a little bit more than that. So let's move along here on the next question. How does diabetes impact minority populations differently than others? Well, in a number of different ways. First, the big picture is it's worse. People tend to do worse in many different ways. So, one thing we know is that blacks are much more likely to have high blood pressure, um, and they're much more likely to develop kidney disease. Their risk of kidney disease is twice that of whites. Uh, but also there are many other issues. Blacks in general are twice as likely to die from diabetes as whites. And when it comes to amputations, they're three times more likely to develop an amputation. And that's really disturbing given the fact that we know that 85% of amputations are preventable. So what is this all about? Why? And poverty is a big factor here. So here's an interesting statistic. For individuals that live below the federal poverty level, they have double the risk of diabetes mortality, double the risk of dying from diabetes. Um, so poverty really impacts diabetes profoundly, and more than 3 in 4 Americans that live in poverty are people of color. So people of color much more likely to die from diabetes, and a big part of that is that many are living in poverty, and so something that we need to address as a society. The next question is, what role does access to health care play in all of this? And it's a huge factor, and in fact explains a lot of. So it is poverty, but it's also access to health care. Uh, Access to healthcare professionals can be a real challenge, and particularly in minority neighborhoods, there is less access. And one of the things that we're conscious of is to train more healthcare professionals from minority populations, because it turns out that sometimes there is uh, an unconscious bias when it comes to uh, uh, prescribing certain treatments. Uh, we also know that access to healthy food is a big issue. Uh, Living in neighborhoods that are what we sometimes call food deserts or food swamps, where the only foods that are available are unhealthy foods, that really impacts how people do with diabetes. So does the availability of a safe place to exercise. Many individuals in minority groups may live in neighborhoods that are just not safe to go out and exercise. Therefore, less exercise, less access to healthy foods, and then affordability of treatment for diabetes is a big issue in minority populations. And I'll talk about that more in a question, because there's in a moment. Um, how can cultural beliefs and practices influence the management of diabetes in minority populations? And this is where food becomes such a central feature, right? Uh, you know, all different groups, we our families and our lives, food is an important part of it. And thinking about healthy foods and what could be good to eat when you have diabetes is really important. That's where going to the diabetes.org, the ADA website, American Diabetes Association website. You can get a lot of information on that. So cultural beliefs and cultural aspects of food really play into how to manage diabetes. And that's why really it's great to meet with a dietitian who can think about what's a good selection of foods and a meal plan for you based on the foods you like to eat, because we all have to eat, and we all like to eat certain foods, and sometimes it might be small portions of that, substituting recipes for healthier options. There's a bunch of information on the ADA Food Hub that has recipes that can be healthy. Okay, we've got a few more questions here. Um, what steps can be taken to prevent or delay the onset of diabetes? Well, here's where I want to tell you about this program called the Diabetes Prevention Program. It's been around for a number of years. It's been shown in a big research study that it lowers the risk of developing diabetes by 2/3. And so it's really effective. And the American Diabetes Association has partnered with Center for Disease Control to expand access to the diabetes prevention program, particularly in initially in 6 states where diabetes is at the highest rates, and this is really in the southern part, or sometimes what's called the diabetes belt. So stay tuned if you live in one of those states, Mississippi, Alabama, Texas, um, Florida, North Carolina. These are states where the American Diabetes Association is really leaning in to help people prevent them from developing diabetes. So check out our website. You'll learn a lot more about this. The the other thing for everybody, and like, what do you do if you have diabetes? I always say it's about the ABCs. A1C, which is a measure of your blood glucose control. So it's A1C for A, B, blood pressure, C, cholesterol. Maintaining good A1C, blood pressure, and cholesterol can prevent a lot of the complications of diabetes, and then screening for those complications early by uh, having your feet checked by a healthcare professional, by doing a urine test to see if you have any early kidney disease, uh, and getting your eyes checked every year. All of those things can really help prevent developing diabetes. So, are there community resources specifically tailored to minorities living with diabetes? Yes. If you go to the ADA website, as I mentioned, there's a lot of information about the appropriate foods that are the kinds of things that different cultures like to eat. Because again, we all have to eat, but make some good choices. And I want to highlight a bit where the American Diabetes Association, as we're thinking here of National Minority Health Month, what we do around this issue. It really is a central part of the last few years of what ADA has been doing. Uh, Back in 2020, uh, we published the Health Equity Bill of Rights, and so check it out on our website. It sort of states what I think we can all agree that it's a listing of 10 rights, and it says everybody living with diabetes should have access to healthy foods. To manage their diabetes. Everybody with diabetes should have access to the technology that could help them live healthy. And so we've been working systematically on all of these different areas. And so I'll just tell you a few things. One, uh, we've been fighting for access to technology and coverage for technology by specifically Medicaid. Uh, and Medicare, so that people living with diabetes, particularly minority communities, have access to this important technology. Similarly, we've been leading the fight on affordable insulin, and you may have heard there's now an insulin cap by Medicare. The companies that manufacture insulin have agreed to cover to ensure that insulin is only $35 a month. And so that's a great option. If you have trouble affording insulin, go to the ADA website. You can get more information. We're also leading the fight for coverage for obesity treatment and have a bill before Congress to address that. Uh, we've been fighting for food access and changing. So it's interesting. The nutritional recommendations that are made, have really not incorporated the specific needs of people with diabetes, and that policy is important because it affects what may be available in schools, what might be available through food assistance programs, a whole bunch of different areas. So the ADA has really been leading the fight for health equity, to reduce the health disparities, and all of that is an important thing for us to recognize as we think about National Minority Health Month. So thank you for joining me. Uh, if you've enjoyed this program, each month we take a different theme. Please send your ideas to us, send your questions to us, and we'll try to get to whatever we can. Uh, Tell your friends and loved ones. And with that, this is Dr. Bob Gabbay, the Chief Scientific and Medical Officer of the American Diabetes Association. Be well, and we'll see you next month.